I didn't accept it for myself for decades that I had a depressive condition. It's very difficult to explain the nature of depression. It defies logic. In fact, what it does do, though, is it sucks the joy of life out of an individual. You see everything in a negative fashion.
Andrew Robb is a former Trade Minister and one-time Director of the Liberal Party. For over 50 years, he's had a type of depression which affects him deeply in the mornings.
In particular, I just wanted to make reference in particular at this stage to the problem I had, well, the opportunity, as it turned out, to confront a mental health problem that I'd had, and it came to a head during my time during Melbourne. Well, I had a condition called diurnal variation, which means you go to sleep taking on the world and you wake up deeply depressed.
He took a range of antidepressants for more than a decade until the combination no longer worked.
It stopped about 18 months ago, and they don't know why. So then I went back into trial and error again. In the course of that, I heard about the psychedelics.
Psychedelic therapy is illegal in Australia, but as these videos show, it is currently offered at clinics in the US, Switzerland, Israel and Canada.
It can actually help people who have addictions problems. It can help people who have anxiety and depression, and they've been testing it, with all kinds of traumatic things like that.
It involves patients ingesting small amounts of magic mushrooms or ecstasy before being provided psychotherapy.
The feelings of anxiety are really just not there.
In wanting to do it myself, take advantage of it, I have tried to explore what it actually does. And there's no doubt that it's quite well agreed that it increases the activity in the brain.
Andrew Robb belongs to a charity called Mind Medicine that wants the TGA to allow psychedelic therapy in Australia.
What we've seen is over 150 clinical trials take place in the last 20 years. We've seen over 3,000 people, patients, involved in these trials, and the results are spectacular. They're getting up to 60 to 80% remission. This is not relief, this is remission. Now, those sort of results are not possible. We've got, at best, 30% of people in Australia will respond to the antidepressants. So you've got 70% who are not responding, and we need to have alternatives.
Well, we're not denying the alternatives. We're saying that we need to do the science to get the safety and get the efficacy to make sure that that's right. The history of psychiatry is littered with things that were great white hopes or great promises that have actually turned out to not be so.
The College of Psychiatrists has opposed any change to the TGA's rules, saying it's premature to support the rollout of psychedelic therapies in Australia.
So there aren't any countries that I would think have reasonable rules that actually have gone to this level of deregulation. So I think it's really important to note that clinics that might be operating elsewhere are probably operating under an experimental rule or outside of those particular rules.
Comes through, man.
There are psychiatrists who believe the college is unnecessarily blocking a medical treatment that could help patients in need.
Anecdotally, many people have had full remission of their symptoms, which is miraculous with PTSD. You know, I'm treating people with PTSD from the Vietnam War, and they're not fixed. They're still coming to see me, and you know that war ended 50 years ago.
Dr. Saker's patient, Matt Wiseman, is a more recent veteran.
I've done 27 years in the Navy and the Army, and, you know, deployed to Timor and the Middle East and done patrol boat boardings and things like that during that time. I've been diagnosed with PTSD, anxiety, depression, alcohol abuse, and drug abuse. And I would like to try something that's been proven overseas to help veterans with depression.
Australia's top psychiatry organisation remains concerned about the message it would send the community if currently illegal drugs were allowed for medicinal purposes.
Drugs that actually cause a lot of problems. That is a big problem facing prescribers at the moment. It's a big problem facing addiction medicine psychiatrists around what to do about that incredible misuse of those drugs that are on S8. What I'm trying to say is I don't think we need to set up another one of those just yet, so we need to be really careful.
Cannabis, it still remains, illegal for recreational purposes, but cannabis has been approved for controlled medical use. There are hundreds of thousands of Australians who today could be taking advantage of the use of these drugs to help therapies.
My family's gone through hell and watched me ride this roller coaster up and down, so something needs to change. And to be honest with you, I just want to be a better dad for my kids.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.